I have to actually say, I think it's almost an insult to our intelligence that on the basis of what we've seen through Zondo, that the NHR is being proposed with this exceptionally weak governance framework that literally hands total control of all funding in the NHR, all appointments in NHR, the establishment of the committees, the CEO, the deputy CEO, everything is managed and controlled by the Minister of Health.
National health insurance is back on the agenda, but what are the risks? Joining me to discuss is Mike Settas. He is chairman of the Health Policy Unit at the Free Market Foundation. Mike Settas, welcome to the CRA. Could you tell our viewers what is the basic thrust of NHI? What is being proposed and where are we in the process at the moment?
It's currently in the form of a bill, the NHI bill, which was passed in Parliament about 3 years ago. And subsequent to that passing of the bill, the Health Portfolio Committee, the Parliamentary Health Portfolio Committee undertook public hearings, which spanned over a period of about 16 months, I think, and ended just a few weeks ago. And subsequent to that, the ending of the public hearings, Dr. Chris presented to Parliament. We're not quite sure on what basis that presentation happened, but he briefed Parliament primarily on where NHR funding is going to come from. The NHR proposal in broad terms is to take the public health sector and the private health sector and combine them into one NHR system, and then to raise taxes to add more funding. So the public budget will come with the public sector, the current public budget, and the private sector will come with additional taxes. And then together, the NHR fund will manage all healthcare in South Africa. And both private and public doctors will be required to effectively work for the NHR fund in delivering healthcare as determined by the NHR. So in a nutshell, that's kind of what the proposal is. And the briefing from Dr. Crisp 2 weeks ago was to discuss those additional taxes primarily, although he did go into a few other things.
All right, so Dr. Nicholas Crisp, he's the Director General of the Health Department, and he is the person responsible for the NHI. And in many of his recent public comments, he has said that both the private and the public healthcare sector have massive problems of fraud, corruption, misallocation of resources, very high medical legal claims against practitioners. Is he correct to draw this equivalency between the private and the public healthcare sectors?
No, I don't think so. Certainly both sectors have their challenges, but they're vastly different from each other. So to create an equivalence, I think is completely wrong. The solutions that each sector requires in terms of improving it, getting it to a better position than what it's in, vastly different. But the NHR proposal is suggesting that the NHR itself can fix both sectors' problems. But broadly speaking, it'll do neither. What would be far better is for the government to implement the findings of the health market inquiry, which was done on the private sector. That inquiry lasted for about 6 years and was evidence-based. It produced a lot of information, solid work from academics, from stakeholders in the industry. It's a great blueprint to fix the private sector. And the private sector's problem is expense. It's very expensive, so it's not accessible to many people. The public sector's problem is just simple governance failures, which then result in mismanagement, corruption, and then failing to deliver quality healthcare. Those are the problems in the public sector, and those need to be addressed through fixing those problems. Overlaying the NHR on top of that is going to cause even more dysfunction for the public sector.
Right, and Mike, South Africa already spends a significant chunk of its public finances on the public healthcare system. And Dr. Crisp is arguing that essentially this is a problem of a lack of funding, that if we just inject more capital into the system, then it will solve some of those problems. But potentially we're looking at an enormous extra burden here by the NHI on the country's fiscus. And I couldn't help but notice that in the budget speech in February, Minister Enoch Godongwana didn't make mention at all of the NHI proposal. So have we sufficiently costed this in terms of the burden that it will place on our government expenditure?
Well, no, it's one of the major failings of this NHR policy process is that no costing has been done. Not even the benefit stack has been decided upon. So you can't do a costing unless you've decided that. So this whole proposal is very much putting the cart before the horse. But I think the issue to come back to cost in and of itself, rather than more funding, is the policy process from the get-go. And this policy process is now 13 years old. It started in around 2009. From the get-go, the argument was simply that public sector needed more money, and then better healthcare would arise. But if we actually have a look internationally at how South Africa compares with other upper middle income countries, of which we also are an upper middle income country, we're spot on the average of what those countries spend on public healthcare. So we don't spend short in terms of the public sector. The problem is the outcomes are bad because the management is poor. It's the usual candidates outlined in the Zondo Commission, this cadre deployment. There's an inability to implement any kind of disciplinary processes within the department because unionized members are protected by the unions. So any kind of shortcomings just carry on without rectification. There are logistic problems, and more money is not going to fix those things. The actual management of the public sector needs to be fixed first before we can even get to a point of determining will more funding bring about better healthcare. I'm absolutely certain that better management will definitely bring about better healthcare, but I'm not certain at all that more money will.
All right, so there are some considerable financial risks, but there's also this governance problem that you highlight, and the Institute of Race Relations has run a campaign against NHI to say that it will be effectively the ESCOM of healthcare, which I think is a very potent metaphor to describe the potential risks there. But what are some of the other risks to the sector? I think one that I can think of is the potential exodus of medical practitioners out of South Africa. Could this trigger a wave of immigration? What other problems do you foresee?
Look, I certainly like the ESCOM of healthcare analogy or metaphor, if you like, because I think it'll be exactly that. The NHR is being designed to be a monopoly because it's going to outlaw medical schemes. They will not be able to provide healthcare in competition to the NHR. And we all know what happens with monopolies. I mean, ESCOM's a perfect example. Costs rise, inefficiencies just creep in everywhere. And it's just the setup for rampant corruption to occur. The problems that you mentioned, the exodus of doctors, I mean, that's been well documented already. A number of surveys, I think Solidarity have done some, SA Medical Association as well. There's a high percentage of doctors who've said that if the NHR comes in, they're immigrating. And, doctors are internationally mobile. A lot of countries are short of doctors. So, they'll put the policies in place to bring them in. So that's a huge problem. The other things are the governance framework in the NHR. I have to actually say, I think it's almost an insult to our intelligence that on the basis of what we've seen through Zondo, that the NHR is being proposed with this exceptionally weak governance framework that literally hands total control of all funding in the NHR, all appointments in NHR, the establishment of the committees, the CEO, the deputy CEO, everything is managed and controlled by the Minister of Health. Now, there's no oversight in terms of those powers. There's no oversight in terms of how it gets appointed. There's no separation of powers. It's an absolute recipe for rampant corruption. And I honestly think the department is insulting us by putting this in the bill and expecting us to accept that, we won't see fraud and corruption to a massive extent with that in place. Very concerning.
Mike Settas, thank you very much. Let's hand over to you, our audience. What do you think will be the impact of NHI if it is implemented? Leave your thoughts down in the comment section below. A quick reminder that we at the CRA produce a new video every weekday morning at 6 a.m. So if you enjoy this content, why don't you hit that like button and also subscribe to the channel. My name is David Ansara. This is the CRA. Until next time, take care.